Hi, I'm Dr. Beltry from Beltry Bariatrics, and today we're going to talk about pregnancy after bariatric surgery. And a lot of my patients ask me, can I get pregnant after bariatric surgery? As you know, bariatric surgery such as the gastric bypass, the gastric sleeve, the duodenal switch procedures can change how you absorb certain nutrients that can affect both the mother and the baby during pregnancy. Well, the answer is yes. Yes, you can get pregnant after losing weight through bariatric surgery. And some patients losing weight prior to getting pregnant can be very beneficial. Bariatric surgery, for example, can treat PCOS. I see a lot of patients that suffer from PCOS and infertility. And of course, bariatric surgery can address PCOS and make it easier for you to become pregnant afterwards. Studies have shown that women that lose weight prior to getting pregnant also have less C-sections and therefore more natural vaginal deliveries. Also, there's less gestational diabetes after losing weight through bariatric surgery. These are all very positive points for someone that's considering getting pregnant after obesity surgery. However, there are important points to consider prior to getting pregnant. A very, very important point to consider is the timing of the pregnancy. When do you get pregnant? Well, it is recommended that you wait at least 1 year, 12 months after your bariatric surgery before you can get pregnant. This allows time for us and your other medical team to check for any nutritional deficiencies. Number one. Number two, for your weight loss to stabilize. You have finished losing weight. We have checked your nutritional status. And now it's time for you to consider getting pregnant, of course, as long as at least 1 year have passed. Remember, as I said before, bariatric surgery can affect your nutrient absorption, particularly vitamins like vitamin B12, iron, calcium, folic acid. And it's important for women who have had bariatric surgery to work closely with their healthcare provider to monitor their nutritional status before, during, and after pregnancy. A recommendation of prenatal vitamins, especially prenatal vitamins formulated for women who have had bariatric surgery, might be recommended. How about weight gain during pregnancy? Well, weight gain during pregnancy is expected, and it is essential for women to have had bariatric surgery, especially to monitor their weight gain during their pregnancy and monitor it carefully. Healthcare providers can provide guidance on appropriate weight gain based, of course, on the individuals and their circumstances. There are potential complications that may occur during pregnancy, especially in women who have had bariatric surgery. They might be at an increased risk for certain things like preterm birth and small for gestational age infants. So therefore, regular checkups with your obstetrician or regular prenatal care and close monitoring is very important to help identify these issues beforehand and manage them before they can become a complication. The mode of delivery. So you gotten pregnant, now 9 months have passed, now it's time to give birth. Well, how are you going to give birth? I mean, there's two options, of course. There is natural vaginal delivery versus C-sections. And of course, these are things that you may need to consider and discuss with your obstetrician. There are things that can affect the mode of giving birth. Weight, how much do you weigh? Remember, as I said, patients that tend to be more on the obese side tend to have more C-sections versus patients that reach a more normal weight. Previous surgical history, okay, and this can be either with the sleeve, gastric bypass, duodenal switch. This will, of course, depend on your discussion with your obstetrician. But having a previous bariatric surgery will not prevent you from either, number one, having a normal vaginal delivery, or number two, even having a C-section. However, there are other procedures, other abdominal surgery that patient might have had that may prevent them from having a C-section. Things like abdominal surgery, like tummy tucks and things like that might have been done in the past can affect that. Well, how about breastfeeding? You gave birth, everything went well. Breastfeeding is encouraged for women who have had bariatric surgery. But breastfeeding provides a lot of good health benefits for the baby and for the mother as well. For the baby, of course, it helps with the nutrition, immune system, developing immune system, things like that. For the mother, it actually helps mother maintain a healthy weight. So yes, breastfeeding after giving birth, after weight loss surgery, it's recommended, of course. You need to monitor your nutritional status while breastfeeding. So therefore, checking for your multivitamins, make sure that there's no deficiency is very important. Overall, pregnancy after bariatric surgery requires careful planning and monitoring to ensure the health and well-being of both the mother and the baby. What happens if you get pregnant before the year? Generally, what happens is that weight loss stops in most patients. They stop losing weight. The weight may remain stable or they might gain some weight. But remember, bariatric surgery is a metabolic procedure. So is pregnancy. The metabolic changes that the pregnancy causes now takes over the metabolic changes caused by bariatric surgery. Some of my patients are lucky that after they give birth, they continue to lose weight, slower, but continue to lose weight. Most of them, the weight loss has stopped, and losing additional weight require a little bit more input from their side. Of course, they still have the portion control, but weight loss generally stops. Again, to answer the questions, yes, you can get pregnant after bariatric surgery, but it's important that you wait at least 1 year. Make sure that you consult with your bariatric physician as well as your obstetrician to check your nutritional status, to check where your vitamins are, make sure that you're healthy from a nutritional standpoint to go ahead and carry the pregnancy to full term. Again, I'm Dr. Beltry from Beltry Bariatrics. I hope this short video helps you with your decision concerning getting pregnant after bariatric surgery. Thank you very much for listening.